Today are you ready? Today I'm presenting on prevention of surgical site infection. This presentation was initially written by Stephen and and I've changed it a little bit as we've gone along, but I left his name on there because he did take part in that. Why do we want to prevent surgical site infections? Because we don't want our patients to get infections. They end up having to have more antibiotics. They have extended stay in the hospital, additional surgeries, and these can be life-changing events. We want to prevent or minimize contamination of the sterile environment through our own sterility as the surgical tech in the room, through the sterile field, and by being observant of others, which would be our non-sterile staff. During your case setup, we want to open our supplies as close as possible to the case start. No unsterile persons or items should ever be reaching across the sterile field. We want to check our peel packs and our wrapped instruments for tears, punctures, wet spots, and expiration dates. And we want to check our sterilization containers, our filters don't have holes, and that our chemical indicators have changed. For your initial gowning and gloving, we want to start our day with an initial hand scrub. That's a wet hand scrub at the beginning of the day, and if your hands are visibly soiled. And that needs to be done for 3 to 5 minutes with the soap and water prep solution. Gown and glove away from the sterile field. For draping, once the drape has been placed, they should not be shifted or repositioned. Handle the drapes as little as possible, as fluffing the drapes causes air drafts that may carry unsterile particles. Shield or cuff your hands when applying drapes. Secure surgical equipment onto drapes with non-perforating devices. And consider your Mayo position once it's been pulled up to the patient. So I'm going to demonstrate that. Let's pretend I'm sterile, I'm gowned and gloved. And I want to, I'm setting up for my case for the day, and let's say it's a lumbar lamb with Dr. McDougall, who's really tall, and we know that the patient height is going to be up here, right? If I set up my Mayo stand like this, well, you can see indicated by the red where the unsterile portion would be, because it drops below the sterile level. So I know that I'm going to be working at a higher altitude. So before I scrub in, while my Mayo stand is still unclothed, I may choose to go ahead and lift it to the height that I anticipate us working at, and then when I scrub in, set it up at that level. But if I couldn't anticipate that I was going to be working at such a high level, then when I discover that, what can I do about it, right? So now I'm scrubbed in, and I'm going to pull my Mayo stand away from this other table, which has a different height, and raise it to the level that I'll be working at. And now when I pull this up to the patient, now I've got unsterile besides sterile, which is no good, right? So how can I remedy this? I'm going to take a drape sheet, and I'm going to cover the skirt of my Mayo stand. Use a non-perforating clamp. And now I can bring this up to the patient without the danger of contaminating. Sometimes our Mayo stand drapes are too short too when we bring them up to the Mayo stand. You can use the same remedy for that. Another area where I see, especially some new folks struggle, is with draping lithotomy position. So if I have my leg cover, this is the toe end, I can put this under my elbow so it doesn't drag the ground. Open up this cuff fully until I see the area that is bound together at the bottom. Now I've got this large cuff. I'm protected as I'm going in. I can see where the handle is, because a lot of times if I don't uncuff it like this, I can get in above the handle and then I struggle to keep all of that sterile. So I can go under the handle. I'm letting go of the toe as I bring the drape down the leg. Now when I get to the groin area, I've got this large cuff of still sterile material that I can fold down onto the groin area. Had I not had that cuffed area, I've drug this drape down the leg, and now what I'm placing on the groin isn't really sterile. So just an example of how to do that. During the procedure, we need to be aware of the sterile area on our gowns. We're sterile from our chest level to the level of the sterile field. Your hands should never drop below your waist. Our arms are sterile from our fingertips to 2 inches above the elbow. And these areas change with sitting and standing near the sterile field. So just to give you a visual, this is my little drawing of a person who is gowned and gloved, and the area that they are sterile is from the nipple line to the waist, and the fingertips to 2 inches above the elbow. As you approach the sterile field, if the patient is at this level, we retain that sterile area. But if we sit, or the level of the sterile field is higher than our waist, we lose some of that sterile area. So see, here's the level of the sterile field. I've now sat down, and so it is now I'm only sterile to mid-abdomen to the nipple line. Be aware of that when you need to change the lighting. If I were to change the lighting, I would need to push back in my stool, stand up, change the lighting, sit in my stool, then push myself in. I don't want to stand up right next to the sterile field and drag all that up, right? All right. During the procedure, with our gloves, we want to change our gloves if there are any holes or tears, after a bowel resection, before implants, and before dressings. During the case, do not reposition drapes. Any item that falls below the horizontal plane below the sterile tabletop is contaminated. We use separate fields for complex cases, which have different wound classes. Separate your instruments and supplies for bowel procedures, such as dirty and clean. Have separate fields of instrumentation and supplies for GYN and laparoscopic procedures, keeping them separated throughout the procedure. Immediately remedy any breaks in sterility on the field. Remove contaminated supplies or instruments, and cover that contaminated area of the field with something impervious, right? Around the sterile field. We need our non-sterile staff to maintain a minimum of a 1 foot distance and not to walk through 2 sterile areas, so we need to keep our sterile areas together and not to reach over the sterile area. Thank you. Are there